Hi, I'm Dr. Bill Johnson of Nations Medical, and we've been asked the question, how important are growth factors in doing a BBL? The answer is, if there are no growth factors, if there are nothing to stimulate our body's response to the transferred fat, all the fat is going to die and we're not going to see results from the BBL. So growth factors are essential for the fat to get a new scaffolding or support network and new blood vessels. So growth factors are an essential part of every fat transfer procedure. The answer is no. The magic occurs not with the change in injection. The magic occurs by activating the fat before it's suctioned and activating the fat in the receiving area before the injections are done. That's done with extracorporeal shockwave therapy, which is well documented not only to release many growth factors, but also to activate or wake up the stem cells in the area. They're both along the same lines. The idea is to jumpstart the activation of growth factors and stem cells in the transferred fat to make it where fewer and fewer cells have to die. Part of PRP's problem is very inflammatory, and it can actually cause some growth factors that we don't want to be present within the platelet-rich plasma. That's much less of a problem with ESWT. It does appear that ESWT is more consistently able to enhance the amount of fat that survives than its predecessor PRP. No one's really done studies yet to see what happens with both. That's probably going to be one of the next steps. The answer to that is really about the same, although the liposuction area may recover a little bit quicker with the enhanced BBL. But the buttocks themselves have always had a real easy recovery course. They don't swell much, they don't bruise much, and they don't hurt much. So any differences would be quite subtle because the recovery from the injection and fat transfer part of a BBL is quite simple. The liposuction part represents most of the recovery, and that probably is a little bit better with the extracorporeal shockwave ahead of time. To the surgical time, it doesn't change it, because the BBL is done in the same manner, but the ESWT, that's the magic of the enhanced BBL, it's done before the patient even gets placed on the operating table. So the surgical time and injection time's not changed. The ESWT is done beforehand, but still just takes a few minutes to accomplish and make the results much better.